Good afternoon, Dr. George. Thank you for giving me this appointment. Thank you for meeting with me. I know you have a busy afternoon, but thank you for giving me this time.
Well, it's really a busy afternoon, and this time is just a quick moment between me running out the door for my next appointment.
Sure, I really do appreciate it. I understand you're busy. Hey, did you catch that Byron Nelson is in McKinney this year?
Oh, they've moved it?
Yeah, they moved it. Wasn't making very good revenue the last two seasons, and then don't forget that Corvette show is there in McKinney as well.
Oh, wow. No, I didn't know that they moved to the Byron Nelson. That should be pretty interesting. McKinney's a neat little town to visit whenever I've been able to escape the busy schedule here.
Yeah, we'll have to make a trip over there. Hey, Dr. George, did you with your surgeries last month, did you have any problems or anything, or?
Oh, typical. We'd walk into surgery and my device was defective, and so we'd have to postpone or, work with the schedule that we have and wait for the rep to bring us another device since the first one was defective. But, the typical things that you run into when you have a device that sometimes just doesn't work.
Does that set you back quite a bit, or does that really throw a wrench in your schedule?
Well, ideally, I like my schedule to stay right, on time and run smoothly. So it's aggravating when you think you're ready and your patient is under, that you have to add a little bit of time and wait for the next device to come in when that happens. So yes, it is aggravating, but it's a busy schedule and the life of a doctor. And as a surgeon, that seems to happen quite a bit.
What about device failure? How is that affecting you as well?
Are you talking about once I've implanted the device into my patients, the failure rate with them, or what exactly are you asking me?
Yes, that is what I'm talking. Post-surgery, any types of problems that you're having?
Well, the devices that we use with Stryker, overall, my patients seem to have a pretty well recovery as long as they follow the post-surgery routine and, make sure that they attend their therapy and work through. Overall, it seems to be just fine, and my patients seem to be satisfied, so therefore I'm satisfied.
So if you would have less scheduling problems, would that be pretty beneficial to you?
Oh, if I could have less scheduling problems, my life would be a lot easier, because the times that we have the issues, if I could resolve those, that would give me the capability of adding at least another surgery to my calendar in a month, and that would be beneficial and take patients that are waiting 6 weeks and really move patients along. But in the life of a surgeon, that seems to be something less than acceptable, and it just seems to be reality that doesn't happen.
So if you could eliminate that domino effect, because I'm sure if you're down one surgery, that's going to affect the rest of the surgeries throughout your week, is it not?
Well, for maybe not the week, unless we have to completely cancel the surgery and reschedule. But usually it does make my 12-hour day become a 17-hour day because there is a delay in surgeries, and that can be frustrating. I do have a family that I like to be a part of, so there is frustration that comes with scheduling when things are run off course.
Dr. George, Smith & Nephew has come up with new technology. We're top notch. We are leading our field with Legion. If we can get like a trial with you, would you be willing to try something in the near future, in the next month, just a trial surgery? How would you feel about that?
Well, I'm always interested in what evidence is showing me that is happening. I understand that technology is a constant revolving improvement in all areas. I have read up on the benefits of the Legion. I know and I'm aware that it is not made of cobalt. So I'm curious as to what technology has to offer. But, I also have a set routine, and I don't have a lot of room to make changes within that.
Dr. George, 89% of patients are recovering, and 90% of those are returning to work within 6 months. Is that something you would like to see within, your patient recoveries? Is that something that you would be interested in seeing, your patients being happy with referrals and, reaching out and saying, hey, this works. This changed my life.
Well, it's always beneficial when your patients come back and tell you that the surgery that you have performed was beneficial for them and that their recovery was complete and they were able to return to their life and make that fulfilling. But I just don't see how your device, the Legion, can offer me that when Stryker is also giving me customer satisfaction.
Well, you had mentioned something on the Cobalt. We are getting away from Cobalt. Through evidence, through research, Cobalt is actually a leading result in decay and actually revisiting surgery through, within 5-10 years, depending on, patient. So what, how is Stryker, dealing with that?
Stryker, my representative comes in and meets with me. We discuss the trials and the patient caseload that I have. We very often we will go back and revisit my patients. We'll look over the surgeries. We will review my progress notes. I really value the fact that my sales rep takes the time to look at the recoveries of my patients. We're going into year, I believe, 9 with my Stryker representative and the devices that I use from Stryker, and we really have been very satisfied with the results that we see with the patients that we have. I have read the updated case material on the Legion that Smith & Nephew offers. I am aware that y'all are stepping away from Cobalt and you're not using that in the Legion. There's just that thing. I've got my routine. I know that it works. I have patients that come back to me and report that their life has returned. They're able to spend time with their family. They're able to get out in the yard and play with their grandkids. And I value the end result that I am able to physically see within my patients. Trials are a big impact with a surgeon, especially orthopedic, in this field. Right now, I still, I stay up. I read my materials that are presented. I have read on the Legion. I am impressed with the return rate on patients, but I really am satisfied with my sales rep and how he comes back and takes the time to review my caseload with me so that we're able to follow up and ensure that Stryker is offering my patients and my clients the best.
I understand. What about our price point at $3,000 for the base model, with you being able to build whatever you want around the base of Legion? I mean, you can come in and customize it more than Stryker with a base pay of $3,000, and then that goes on. How do you feel?
$3,000 is I feel that's a fair price. It is a little more costly than what I am paying for Stryker. And I really need to be able to see the value when you're asking me to ask, my patients, this is coming from their insurance. This is coming out of their pockets. I like to ensure that my patients are getting their money's worth. And I like to ensure that, in the end, that I can walk away knowing that my paycheck was paid, on honesty and integrity. And that is a little bit more costly than what I am paying for Stryker. Now, the fact that I can design that, that is interesting. But again, I just really am sold and confident in the Stryker products and devices that I am using within my surgeries. And I just don't know that anyone can beat that customer service and that relationship that I have with my rep. That goes a long way. I know that I've got the dependability. I know that if we run into a problem, the sales rep is there. And it's just, knowing that I'm going to pay a little bit more, it's that customer satisfaction and that relationship that I have with my sales rep that is hard to beat.
Okay, Dr. George, would you be willing to schedule a trial surgery within the next month? Would you be willing to just give me a shot?
I really would like to. I mean, our schedule is just crazy right now. With the pandemic, we did face, a lighter caseload because we did have to postpone our elective surgeries. So, unfortunately, some of my surgeries, I have clients that this is considered an elective surgery. My caseload is light, but I just really am satisfied with Stryker. I am not interested in putting my patients through a trial run with a new product at this time. I really would like to see some more research on the Legion and feel confident in the fact of the numbers that are being reported right now.
I completely understand, and I hope in the near future that you would give Smith & Nephew a try with Legion. I truly believe that with our price point, what we guarantee, what we offer as far as building around a base is very doctor friendly, benefits the patient. But I appreciate you giving me the time. I really appreciate what everything you've done for me, meeting with me, going through all these follow-ups. If I could continue to visit you possibly once a quarter to bring in what the new technology that we're coming in with. We're constantly coming out with new technology. Every year we come out with new technology biannually. If I could still come visit you and share with you what we have come up with, that I can pass you, maybe you can give me a shot in the next 6 months. I would really appreciate that. And I know you're busy. I know you're trying to get to surgery, but I will keep you informed with the new technology, the new price point, how we can build the new materials that we're using. If I can still present that to you, would you be willing to at least give me another visit in the next 6 months?
Oh, sure. And in the next 6 months, John, when I see you again, we'll be able to talk about the Byron Nelson and who took home that trophy.
Thank you, Dr. George. Thank you for your time. I know you got to run, so I'll let you go ahead and go. I appreciate your time. Thank you.
Yes, sir. Thank you.